Okay, speaking of how to care for cancer patients, including survivors and their families along the way, I want to bring up Dottie Shead next. Dottie is with NCCN, and among her various activities is one with which I've become familiar over the years, and that is she's involved in development, updating, and publication of NCCN clinical practice guidelines. NCCN guidelines, I'll just tell you, is kind of a third-party observer, given my sort of day job work that involves industry and payers in the public and private sectors. In cancer care, everyone starts with the NCCN guidelines. So coverage policies, prior auth issues, all the way utilization management, how we pay, what we cover, and so forth. It all starts with, okay, well, what do the NCCN guidelines say about this? And Dottie, I know, is going to focus in particular today on one or more pediatric cancers in the context of the guidelines. Dottie, over to you. Dottie may be on mute still. Is she?
Thank you. It is my absolute pleasure to be here today to speak with you. I have experience working on the clinical practice guidelines, as well as overseeing the development of our patient information, our patient guidelines. And that is in conjunction with the NCCN Foundation, who is currently celebrating 10 years of supporting patients and their loved ones affected by a cancer diagnosis. Next. Bob touched on the mission earlier, but I just want to repeat that the NCCN Foundation empowers people through knowledge and advances the mission of NCCN to improve and facilitate quality, effective, efficient, and accessible cancer care so patients can live better lives. Next. So the NCCN Library of Patient Guidelines has grown tremendously over the last 10 years, and that is due to the support and the success of the NCCN Foundation. We currently have 49 books in the library, and we will be adding 4 new books before the end of 2020. This is really important. It means that 95% of people with cancer will have free access to NCCN patient guidelines for their cancer type, as well as supportive care guidelines. So far in 2020, there have been over 20 million downloads of the patient guidelines. And if you do not know already, the patient guidelines are a derivative product based on the clinical practice guidelines in oncology that Cliff was referring to. Next slide. So our newest guideline is the NCCN Guidelines for Patients Pediatric ALL. This is the most common pediatric malignancy, representing 75 to 80% of acute leukemias among children. These guidelines are comprehensive yet easy to follow. They begin with basic disease-related information. They provide explanation of testing required for a proper diagnosis. The treatment is then individualized based on specific type and unique presentation. And there are descriptions of types and treatments, and they're all detailed in the chapters. In addition, there are recommendations for supportive care. The guideline also offers tips for caregivers to use to prepare a child for treatment, and it also lists questions to ask your medical team. This guideline was posted on September 23rd, 2020, and it has had over 6,000 downloads already. And I just wanted to add the little quote that our panel chair, after reviewing, even though they reviewed the guideline during the production of it, just felt so moved that they sent us another line just saying they how blown away by the quality and usefulness of this document. That is such high praise, and we were just so excited by receiving that. Next slide, please. So to accompany a pediatric guideline, we felt it is very important to also have an AYA and feature that in this talk. So an adolescent and young adult patient is diagnosed with cancer between the ages of 15 to 39 years of age. AYAs often have different needs and challenges than patients of other ages. These younger patients with cancer may face challenges, but they also bring special strengths to the fight. Often they require different types of support other than older patients whose bodies are at different stages of life. This resource specifically addresses their challenges, explains common tests and procedures used to diagnose cancer care, addresses fertility and future planning, assists with navigating the treatment process, and offers tips and support for many of the issues that AYA patients may deal with. NCCN first published the very first version of this guideline in 2013, and it has been updated since then several times. The most recent update was posted April 30th in 2019, and in 2020 alone, it has been downloaded over 21,000 times. Next slide. And we're super excited now to add to our patient library the NCCN Guidelines for Patients' Survivorship Care. An individual is considered a cancer survivor from the time of diagnosis throughout treatment and for the rest of his or her life. With better cancer care, people with cancer are living longer. The NCCN Clinical Practice Guidelines for Survivorship were divided into 2 new resources for patients. The focus of these is to maintain and enhance wellness in cancer survivors. And they also described options for dealing with potential long-term and late effects of cancer treatment. So the books are titled Survivorship Care for Healthy Living and Survivorship Care for Cancer-Related Late and Long-Term Effects. These guidelines are meant to be used as a supplement to follow-up recommendations within our disease-specific guidelines. And it was also noted, and I know our first speaker, Jan, said as well, you do not have to wait until you finish treatment to start your survivorship care. That's a really important point. So NCCN and the NCCN Foundation are just so excited for the release of these new books later this month. The production of these booklets was a huge undertaking, and it would not have been made possible without the time, dedication, and expertise of the NCCN panel led by Dr. Crystal Denlinger and the amazing team at NCCN headquarters. So stay tuned for the launch of these books. I'm so excited to share them with you. Next slide. So accessing the NCCN guidelines for patients, the books may be accessed through 3 different avenues. Online at nccn.org/patients. You can download a PDF or you could print free copies. Sometimes there are voucher programs and it would be noted next to the guideline if a free copy is available to be sent to you. There is also our mobile app available for Android and iOS. And then you can always just, you can order a print version. They are accessible on Amazon.com for a very low price. And that would be all. Thank you so much.
Well, thank you, Dottie. I don't want to have it lost the following issue. The idea of having a guideline directed to patients, directed to survivors, is actually a pretty new thing. It wasn't long ago where it was just enough to get a somewhat evidence-based clinical practice guideline for the physicians, the clinical community. I very much have learned to appreciate there's an art and a science and great skill in translating a clinical practice guideline into something that is useful for patients. We have to think about what grade reading level. It can't be too short. It can't be too long. It has to be visually appealing. It cannot be anything less than evidence-based. And so to the extent that NCCN has kind of expanded into doing patient-focused guidelines and guidelines for survivors is an important step. And I think it really extends the reach of the guidelines beyond the original community. So it's very much appreciated. And I know that these kinds of products, we're going to start seeing them diffuse more broadly, and others are going to follow the model of NCCN in trying to make those translations. But again, not to be lost, it's no mean feat to make that translation something that was really useful for patients. So Dottie, Shead, thank you so very much.
Oh, thank you.
We're now going to take a 10-minute break. We're going to reconvene at 1:45 Eastern Time, 1:45 Eastern Time, at which point we're going to have our first panel discussion on addressing age-specific needs and preferences throughout adulthood. So needs and preferences, we've got a great panel coming up for you then. And we'll see you at 1:45 Eastern. See you soon.